Well, welcome everyone. I'm thrilled to see so many familiar faces out there and some new faces. Love it. Thank you also for coming out. We've got a little, the weather, it's, that usual unpredictable right now, so I appreciate you coming out here to hear this presentation by MaryAnn Halpin on the heart and mind connection. I can't wait to hear about this. So before we get started, I wanted to just take a moment to share with you why we put on these events. This heart-to-heart educational event is part of the cardiovascular team's mission here at Unity Point Health to take care of the hearts of our communities so that people live healthier and happier lives. So that's really what overarches all these programs that we offer out in the community. And as you know, some of you have been I've had the honor of doing the Cooking with Heart with you. So we have a couple of those coming up if you're interested. So in April, Cooking with Heart for Diabetes, and then in May, we're going to be offering the foundational Cooking with Heart, and then also the cancer. So you're welcome to bring a friend or a significant other also along to those classes. So, and you can register, there's no cost there. And I also wanted to mention a big shout out, thank you to our parish nurses back there. They offer blood pressures at every one of our heart to heart. So Rosemary and Linda, so big thank you to both of you. And also, if you want to contact us, okay, let's see. Oh, there it's cooperating. So if you want to contact us, I've got the email there on the screen and the phone number, and then we have a monthly newsletter. So on heart health. So if you're not getting that, let us know at the checkout table, and we'll get you on that list to make sure you get that, and also get notification of these events and other events like this in the community. Well, I want to get started now with introducing our speaker, MaryAnn Halpin. So she grew up in the Quad Cities. She's graduated from United Township High School, and she attended the University of Illinois for both her undergraduate and graduate degrees. And her graduate degrees were in public health, rehabilitation, counseling, and occupational therapy. And she has been with Unity Point Health Trinity for a number of years. For 6 years, she was in outpatient, where she was working with people in a rehab capacity for post-stroke, following illness or injury, surgery, including heart surgery. And since 2016, she's part of the Robert Young Center Community Support Program Leadership Team. And she can tell you more about what she does there at Robert Young Center, a lot of great things there happening. And then she's also adjunct faculty at Ambrose University for occupational therapy students. And some of her hobbies include reading, crafting, gardening, exercising, and being outdoors. Don't you love that? And she's a full-time swim mom. She's actually a swim meet official. And she lives in Rock Island with her husband, Mike, and her 2 children, Natalie and Will. And please help me welcome MaryAnn Halpin.
Thank you. Can you guys hear me okay? Through this one? Super. All right. Well, thank you guys so much, and thank you, Teresa, for having me. I was really excited to come and share what I could as far as connections between heart health and mental health. 2 areas that I've worked in directly. I heard some chatter. I just want to explain all the letters here behind my name because they're probably not ones you see typically, MD or RN. So I'm an occupational therapist. So that's the OT. The R means I'm registered nationally. So I took and passed the national exam. And the L is that I'm licensed in the state of Illinois. So that's what those mean. And then the QMHP is kind of the mental health side. So that means I'm a qualified mental health professional. And like Teresa said, I worked in kind of more the physical world. So I worked here at the hospital for several years. I worked on the inpatient rehabilitation unit and also on the other floors of the hospital. delivering occupational therapy services. So, folks who had had a stroke or another neurological event, spinal cord injury, surgery, illness, injury, helping those folks kind of get back to, activities of their daily life following that. And then for the last 8 years, which I can't believe it's been that long. I can't believe I'm that old to have worked somewhere that long. I've been down, I kind of made the switch to the mental health world in occupational therapy. So I work for the Robert Young Center, which hopefully you guys are familiar with. It's kind of the mental health treatment arm of Unity Point Health. So I've been there at one of our outpatient areas for the last 8 years. So the Robert Young Center, offers the gamut of mental health services from, mental health inpatient services through outpatient services, offering therapy services and psychiatric services for kids, teens, adults. And then we also have kind of a substance abuse service line, so inpatient substance use treatment and outpatient as well. We have some residential facilities that we operate. So Robert Young does a lot in the world of mental health. So I work in that area, one of our outpatient areas. So I don't know if anybody has any questions about what I do or who I am, or we should just dive into it. Ready? Right. A clicker. I don't remember. There you go. Okay, so I'm going to talk here about kind of the link between heart health and mental health, because they do influence each other. I'll show a graphic in a little bit. It's a very kind of cyclical relationship that they have. Our body is a system, and if we upset one part of the system, it can often cause upset in another part of the system. So they're very much linked, just like a lot of other body systems. So first, just some general definitions. I wasn't sure, the audience I was speaking to. So when we say heart health, what are we talking about? So heart disease, so we're referring to several types of heart conditions, such as coronary artery disease. And these are things that can lead to, heart attacks, heart failure, strokes, things like that. Risk factors for heart disease that I'm sure you guys learn about in this series. High blood pressure, which is why we have our lovely nurses back there checking that. Blood cholesterol, smoking, overweight and obesity, unhealthy diet, physical inactivity, and as well as excessive alcohol use. So those have all been shown to be risk factors for heart issues. And then when we talk about mental health, we are speaking about our emotional, psychological, and social well-being. And these things affect how we think, how we feel, and how we act. And I want to clarify as well, when we say mental health, everybody has mental health. Everybody feels anxious from time to time. Everybody feels stressed. Everybody can feel depressed. So when we talk about mental health, we're not just talking about those with an official diagnosis. Everyone kind of experiences the spectrum of emotions, so everybody struggles with mental health from time to time. That's just life, without having a formal diagnosis. But when we do talk about those mental health disorders, those actual diagnoses, these are some risk factors for those. So adverse childhood experiences, so those are things that happen to us when we're very young that can affect our mental health going forward. Any trauma or abuse, experiences related to any ongoing medical conditions, different biological factors or chemical factors or imbalances in the brain, use of alcohol or drugs, and having feelings of loneliness or isolation. So those have all been shown to be some risk factors for mental health issues or mental health disorders. Any questions about those definitions going forward? And please feel free to stop me, raise your hand, shout out if you have any questions or comments or anything. Okay, so links between heart health and mental health. And my intent wasn't to just kind of read you all the words on all of these slides, but I wanted you guys to have the information. The more information, I think, the better. Information is power. So essentially, this slide is discussing the links between heart health and mental health. And as I said, they're there. They're very much connected. For years, it was more thought that the connection between the two was strictly in someone's actions. So if someone was feeling down or depressed or anxious, they would take certain actions, such as using alcohol, drinking, eating unhealthily, not exercising, kind of not taking care of themselves. And that would in turn lead to some of those heart issues. But they've discovered, over the years that there's actually some real physiological connections as well. So it's not just, how you feel, it affects your behavior, which affects the heart health. There's some actual links that they found that can trigger some things going on in your heart that we'll talk about here in a second. And the CDC, there's a large body of research showing that the mental health risk factors are often similar to the heart health risk factors. So they're very much connected that way, and kind of telling where one ends and one begins can be tricky, but they are very much related. So when we talk about those mental health symptoms and those behavior choices, so these are some of those ones specifically that can change your actions, and that would in turn, make you more susceptible to having some heart problems. So making fewer healthy lifestyle choices regarding nutrition and exercise, increased use of cigarettes, alcohol, or other drugs, changes in your sleeping patterns. So mental health symptoms can really affect your sleep, whether that be sleeping too little or sleeping too much. And then also failing to take prescribed medications. Sometimes when people aren't feeling their best mentally, they just kind of, they don't care about taking care of themselves. So they might not take medications that they might be needing to take. So over time, all of these behaviors can cause an increased risk for heart disease. Does that make sense? And then these are, this slide kind of talks about those actual physiological changes. So these aren't those behaviors. These are things that actually happen kind of at the cellular level in your body when you undergo things like stress. So when you're undergoing stress, we define stress kind of two different ways. One of those is acute stress. So that's something kind of a stress that's really short-lived, kind of something all of a sudden that comes up and you're stressed about this one thing, this one point in time, and you have stress that way. There's also what we call chronic stress. So this is stress that you experience over a longer period of time. So something in your life that's kind of ongoing, that's stressful, can lead to having chronic stress. So the acute stress, this causes an increase in your heart rate and stronger contractions of the heart muscle, along with stress hormones, adrenaline, noradrenaline, and cortisol. So those hormones are all part of a stress response. So if you've heard of like fight or flight, so some, I think the classic example is being chased by a bear. If you're being chased by a bear, there are things in your body that happen to make you able to run from that bear or fight that bear or whatever it is that you need to do. So it increases your heart rate, so your blood can get pumping. It can get blood to the muscles that need to act. So these hormones are released when somebody experiences an acute stress situation. So the blood vessels will dilate. It's increasing the blood that's pumped to your body, and it elevates your blood pressure. Chronic stress is similar, but this can cause longer term and kind of more chronic increase and raising of those levels of hormone. So that can lead to the risk of hypertension, heart attack, or stroke. So you can see, all of these stress reactions have an effect on the heart and on the blood vessels. So prolonged stress can certainly make you more susceptible to having buildup in your arteries, having different metabolic diseases, and contribute to heart disease.
When you say stress hormones, is that the cortisol that they?
Yes, that's one of them. Yep. So that's the adrenaline. Yep. So all those things that get released into your bloodstream to take those actions. Yep. So yeah, cortisol is a stress hormone. And then this is an area of literature that I think is kind of still being explored, and I just wanted to include it in here just kind of for thoroughness. but different mental health medications. So if somebody takes medications for, maybe it's depression or psychosis or anxiety or anything like that, there are some medications that can have an effect on your cardio system. So some of those medications, might cause an increase in your weight, increase in your blood pressure, or different things in your body. So, when a doctor prescribes one of those medications, they kind of keep an eye on those things and kind of balance taking those medications with kind of some of the side effects that they might have in your body. So that's something that can influence. Yeah, go ahead.
How do you test for insulin resistance?
I do not know the answer to that. How do you test for insulin resistance? I'm not a nurse, so I don't know the answer to that.
There isn't a standardized, there's tests, but one of the issues with insulin testing is standardized tests. So there isn't standardized testing for insulin right now in ranges and labs and that sort of thing. But it's something you can talk to your doctor. So there's other ways to look at the insulin resistance. So, but yeah, good question.
Yeah. And I know folks that I work with at the Robert Young Center or clients that we have at our center that are on some of these different medications, they get regular blood draws. I know A1C is something that they look at for diabetes. So I know that they look at different things to kind of make sure everybody's kind of where they should be with some of those levels. Yep. So it's just something I think that physicians would want to monitor and just sort of keep an eye on, because there has been shown to be some correlation between those things. There we go. And so we've been talking about how mental health can influence heart health, right? But heart health can also influence a person's mental health. So, if somebody has a chronic health condition, even if it's not heart related, that can cause anxiety, right? That can cause worry and stress. You're worried about managing this illness, you're worried about maybe paying for your medications or family members taking care of you. So there's a lot of worry that can come with different illnesses and conditions, no matter what they are. So evidence shows that things like depression, anxiety, and PTSD, which is post-traumatic stress disorder, are things that can develop after cardiac events, including heart failure, stroke, and heart attack. So folks are worried that they might have another heart attack, or they're worried about, does this affect how long I might live? Does this affect my life with my spouse? They're just kind of worried about all of these things. So sometimes that prolonged worry about that can lead to some of these symptoms. And things like depression can, if somebody already has depression or anxiety, can be further complicated by adding, a major illness or cardiac event or stroke on top of that. So folks can, have their mental health influenced, obviously, by something major that might happen to them. So this is a great graphic that I found from the CDC website. It's even animated, which I love. So, it talks about how it's related, right? Everything influences everything. Your behavioral pathways here that might be affected, including medication, not taking your medication, maybe smoking, not being physically active, things that might happen that would lead to mental health problems. And then that can feed into further heart things. So they just kind of keep feeding each other back and forth. Does that make sense to everybody? Any questions about that? So what do we do about it, right? How can we address some of these things? And what's advantageous, I guess, is because they're so related, that you can make a change in your life that could influence, or that could better both your heart health and your mental health, because they're so cyclical and they're so related that you can do one of these things and it might help both issues that you may have going on. So these are kind of, we'll go into these a little bit more here, but the major ones here that I've listed for managing your health overall, heart and mental. The most important one might actually be talking to your provider. The provider is the one that can diagnose things, find out if things are going wrong, giving you medication if you need it. So it's always great to talk to your provider about what's going on, both mental health-wise and physical health-wise, including your hearts. Being aware of mental health symptoms, so we'll talk about that a little bit more, but just kind of knowing what's normal as far as mental health symptoms, what's not normal, what might lead somebody to seek a formal diagnosis or formal treatment for a mental health issue. And then the next category is choosing healthy habits, which is everyone's favorite to do, I'm sure. All those things we know that we should do. But it's a little difficult to do them all, I would say. So choosing healthy habits, so getting adequate sleep, getting some physical activity, practicing good nutrition, taking your prescribed medications, and decrease or quit smoking and use of alcohol or drugs. So those are all some habits that we can adopt that can help both our mental health and our physical health, heart health. Then we have managing stress. So we all know stress is a part of life, both acute stress and chronic stress, like we talked about. But as we've learned, those have physiologic effects on the body. So those do have some possible effects over time on our heart. So anything we can do to manage our stress is always going to be something that we want to do, whether it's for our hearts or for our minds or for our loved ones. It's always good to manage your stress. So in managing your stress, related here is developing coping skills. So that's something we talk about quite a bit in my world in mental health, because like I said, everybody experiences stress. Things happen to everybody that are difficult to get through. But if you have coping skills, that's going to help you be able to deal with those things and maintain, your overall health and well-being. Utilizing self-care. Are you guys familiar with the concept of self-care? Taking care of yourself, kind of doing those everyday things or those special things that kind of fill your cup, we say. And then also enlisting support. So having loved ones that are looking out for you, that maybe are making sure you take your medications, that you can talk to if you're feeling down or anxious. Enlisting support is also a big one for your health. So talking to your provider. So a provider will likely want to talk about both your physical health and your mental health. So those are things that you can talk to any provider that you see about both of those areas. We have specialists in mental health and we have specialists in different physical health, but you can always start with the conversation with your general practitioner or whatever specialist you might see about these things, and then that person can direct you to some further care if it's necessary. But these are the things that a provider would speak with you about in talking about these things. So your sleeping patterns. Are you sleeping maybe too much or too little? Have you had any weight loss or weight gain that maybe isn't explained by something else, or maybe you're not trying to lose or gain weight? Symptoms of fatigue or any loss of energy, feelings of hopelessness, worthlessness, or loss of pleasure in activities that you typically enjoy. That might be a conversation to kind of get at the mental health piece. Your use of cigarettes, drugs, or alcohol, and to what extent you might use any of those things. And I'll plug in here that I always tell my clients it's important to be honest about that. Doctors and providers can't help us if they don't know, exactly what we're dealing with. So, being honest with these questions is important. They might ask about your physical activity habits, your nutrition habits, as well as your stress levels and what coping skills you might use or that might work for you or that you have access to. And then finally, they might talk about your support network. So all of those things that we've identified that can help with our physical and mental health, our provider wants to assess all of those things to kind of see where we're at with everything and what interventions might need to be had. The next bullet point was being aware of mental health symptoms. So in these next 3 slides, I kind of go into kind of more nitty gritty about some of the more common mental health diagnoses. So the first one here is depression. And, you know, most people know what depression is, what anxiety is, but these are kind of the formal things that a provider might look at in order to diagnose somebody with depression. And there's you know, kind of a length of time that this has to be present, and a certain number of these things that have to be present in order to cause a provider to give a diagnosis. But these are those things. So when, you know, this depression lasts for a long time and interferes with your normal everyday functioning, there might be reason to suspect a diagnosis of depression. So symptoms of this might be feeling sad or anxious often, or even all of the time. Not wanting to do activities that used to be fun for you. Feeling irritable, easily frustrated or restless. Having trouble falling asleep or with staying asleep. Waking up too early or sleeping too much. Eating more or less than usual or having no appetite. So any changes in your appetite, either way. Experiencing aches, pains, headaches, or stomach problems that don't improve with treatment. We see this especially in kids. Sometimes their emotions come out in a stomach ache or a headache. So that's especially important for some of our younger folks. Having trouble concentrating, remembering details, or making decisions. Feeling tired even after sleeping well. Feeling guilty, worthless, or helpless. And also thinking about suicide or about hurting yourself or others. So those are kind of some of the screeners, I guess, or some of the criteria that a provider would use for depression. And then anxiety is the next one. So anxiety is when worry lasts for 6 months or longer, often or even in the absence of, you know, big life changes that might explain some of that anxiety. And it's when it interferes with daily activities such as your job performance, your schoolwork, or your relationships. So symptoms of anxiety, there's a lot of physical symptoms of anxiety. So feeling restless, agitated, or on edge, getting tired easily, having trouble concentrating, feeling irritable, experiencing muscle tension or knots, and having trouble sleeping, including falling asleep or staying asleep once again. So the last one I included here is just kind of some of the more common mental health symptoms people experience is stress. So stress isn't really a diagnosis. Formally, there's diagnoses that are related to stress, but a provider wouldn't diagnose somebody with stress. But stress is kind of defined as feelings of fear, anger, or can cause, feelings of fear, anger, sadness, worry, numbness, or frustration, changes in appetite, energy, desires, and interests, trouble concentrating or making decisions, having nightmares or sleeping problems, other physical symptoms like anxiety with headaches, body pains, stomach problems, or even skin rashes or itchiness sometimes too. Worsening of chronic health problems and other mental health conditions, and can be associated with increased risk or increased use of alcohol, drugs, or even the misuse of prescription medications. So those are all things that can be caused by stress in someone's life. So next we'll get into those healthy habits. So the first one that we listed on that first page there was getting adequate sleep. So not getting enough sleep is linked to an increased risk for obesity, type 2 diabetes, high blood pressure, and some different heart conditions, as well as some mental health challenges. Our bodies need sleep. It's just a fact of life. We can't go without sleep. And even one night of not enough sleep, I'm sure everybody in this room has experienced too. If I don't get enough sleep the next day, no good. So sleep is very important, and you really can notice it if you're short on sleep. So some habits to improve sleep. You want to be consistent. So going to bed at the same time each night and getting up at the same time each morning, including on the weekends, can help improve your sleep. So our bodies have, a rhythm that if they get used to kind of waking up and falling asleep at the same time, our bodies kind of fall into step with that and kind of do it naturally. I know my mom could wake up at exactly the same time every day without an alarm clock because she was so consistent with her sleep. So being consistent can improve your sleep habits and your sleep quality. Making sure your bedroom is quiet, dark, relaxing, and at a comfortable temperature. Removing electronic devices such as TVs, computers, and phones from the bedroom. When we watch TV before bed or we're on our phone before bed, our brains have a signal to stay awake, right? There's light and there's noise and I have to think about things. Our brains are getting signals to be active. So when we do those right before bed, it's harder for our brains to kind of calm down and realize like, hey, it's time for sleeping. You want to avoid large meals, caffeine, and alcohol for bedtime or before bedtime. That can make it more difficult to fall asleep. Not using tobacco, nicotine and tobacco can affect your sleep. And then getting exercise. So being physically active during the day can help you fall asleep more easily at night. Any questions or comments about sleep? Yeah.
Do you have a time frame for the exercise before bedtime? Is there a couple hours, 3 hour window?
I don't know if there's research supporting that. My best guess just is probably, I think it would be difficult to exercise and then go straight to sleep. But I don't know like facts about that to support that, but that would be my guess. Yeah, probably similar to eating, I would guess. You kind of want your body to wind down after those activities. Yeah. And then sleep quality is also important. So you not only want to get enough sleep each night, but you also want good sleep quality. So our bodies have a sleep cycle. I'm not a sleep expert, but you want to go through the cycles of sleep and have enough REM sleep and kind of all those different stages of sleep. So if your sleep is interrupted or the quality isn't good, you might not get through all those cycles adequately. So that can affect feeling sleepy or tired despite, I was in bed for 9 hours, I don't know why I'm tired. It might mean that the quality of your sleep wasn't great. If you're repeatedly waking up during the night, if you're having symptoms of a sleep disorder, so something, sleep apnea, if you're kind of gasping for air, kind of having those pauses in your breathing, that's something that probably would affect your sleep quality. So that would influence all of that. And then physical activity. How do we all do with physical activity in the room? So lots of benefits of physical activity. And I'm not saying, everyone has to go out and train for a marathon or anything like that. Just even walking, 10 minutes of walking counts. So even something like that, or just chair yoga, things like that, you can get the benefits from physical activity. And there's so many. Lots of mental health benefits that I could probably give a whole presentation about. But there's hormones, again, that are released when you exercise, and they're kind of feel-good hormones. They're happy hormones, so they kind of energize you and kind of get you going. And then if you exercise, typically people feel pretty good about themselves after that. Like, hey, I exercised, I did something. I'm proud of myself. I set this goal to exercise and I did it. That makes me just feel good. That makes me just happy. So there's mental health benefits to exercise. Physical activity can also help with weight management, obviously. It can help reduce some different health risks, so including those related to heart disease and stroke, type 2 diabetes, and other metabolic syndromes. So the more you exercise, the lower risk for some of those things can be. You can strengthen your bones and muscles especially, your bones with kind of weight-bearing activities. So lots of different exercises can have advantages to strengthening your bones, improving your flexibility and your musculature. It can improve your abilities for daily activities and also prevent falls, which becomes important as we get older. The stronger your bones and joints and muscles and everything are, the better able you are to do those things that you need in your life and do them safely. It can help manage chronic health conditions and disabilities. So there's some research about, persons with arthritis. It can reduce pain, improve your function and quality of life if you exercise, and then also help control your blood sugar levels and lower your risk for some different things that might be associated with type 2 diabetes. And here is a graphic, again, from the CDC about physical activity. So these are recommendations in general for adults aged 18 to 64 and adults aged 65 years and older. And both of them are at least 150 minutes a week of moderate intensity activities such as brisk walking. And then also at least 2 days a week of activities that strengthen your muscles. So maybe weightlifting, something like that. And then as we age, it's important to improve our balance. So things like standing on one foot to improve our balance. And again, that can help prevent falls, especially as we get older. And then good nutrition also. So a couple of resources here that I think are really great. There's dietary guidelines for Americans and then the USDA's My Plate plan. So in general, we could give a whole lecture on this, I'm sure too, but in general, a diet that emphasizes fruits, vegetables, whole grains, and fat-free or low-fat milk and milk products, including a variety of protein foods like seafood, lean meats, and poultry, eggs, nuts, seeds, soy products, beans and peas, so a variety of protein sources. Low in added sugars, in sodium, saturated fats, trans fats, and cholesterol, so watching some of those numbers in your foods, and also staying within your daily calorie needs. So everybody's caloric recommendation is different, whether you're male or female, or how tall you are, how much you weigh. So everybody's calorie recommendation is a little bit different, but staying within that is also a recommendation. So having good nutrition, obviously, I'm sure you all know, it impacts your heart health, but it also impacts your mental health too. If you eat something kind of, fast food or something, sometimes you feel more sluggish or just kind of like, ugh, I can't believe I ate all those chicken nuggets, or so, and then sometimes too, if you have something that's a high carb meal, sometimes you kind of have that crash mentally, and you're not able to concentrate as well. So there are some links between practicing good nutrition and your mental health also. And I think it's just like exercise. If you eat a great healthy salad with chicken and all kinds of great stuff in it, and you're like, look at me, I ate a salad today. I didn't go through the drive-thru. Yeah, I'm doing good. So that can influence your mental health also, make you feel good, like you're achieving your goals and moving toward some of those healthy things. A more habits here, taking prescribed medication. I didn't give it its own slide. I think that's pretty self-explanatory. But obviously taking medication that's prescribed to you in the way that it's prescribed to you is going to benefit your health, whether it be a physical health reason or a mental health reason. So taking those medications, decreasing or quitting smoking and the use of alcohol or drugs. So here's kind of some things that smoking can lead to. So raising your triglycerides and lowering your good cholesterol can affect your blood clotting abilities and blood flow, damaging cells in your blood vessels, buildup of plaque, and thickening of your blood vessels. So there's a lot of things that smoking can cause. So if a person can quit smoking, phenomenal. If they can even just cut back on smoking, that's great too. Anything that they can do along those lines will be beneficial for their health. Similarly, use of alcohol or drugs also. So over time, excessive alcohol use can lead to some chronic diseases or problems, some concentration things, some alcohol use disorder, which can have some physical effects as well. Other things that are linked to excessive alcohol use are things like high blood pressure, which in turn can affect the likelihood of having a cardiac event or stroke or something like that. Also, binge drinking. So binge drinking is drinking like a whole lot at one time. So instead of, maybe just having a couple drinks, somebody has a lot of drinks in one sitting, or heavy drinking can cause heart disease issues, including cardiomyopathy, or irregular heartbeat or high blood pressure.
Question.
Yes.
Are you seeing much change going on with the legalization of marijuana and THC from the Illinois side?
Change as far as mental health?
Anything
Not
very much related to that, or any
Not
testing
in
going
my
on, or-
practice. So a team that I work on is people who are experiencing first episode psychosis. So people who are for the first time experiencing, hallucinations, hearing voices that other people aren't hearing, or seeing things other people aren't seeing, or being paranoid maybe. And we know that marijuana really affects those symptoms. And we know a lot of clients will self-medicate using marijuana because it will let them not think about the voices or not think about their paranoia, kind of escape from those symptoms. And we also see that marijuana really affects the medications that folks take, so it can make the medications for psychosis especially less effective. So we do see effects of folks using marijuana who also have a mental health diagnosis. I can't really say if it's related to any legalization at all. I think folks that were maybe going to use marijuana before, were going to use it before it was legal. So I have not personally experienced any direct effects, but I don't know that I would really in my practice. So good question. And this slide here, so I kind of put, all those bullet points we talked about earlier, the manage stress, develop coping skills, using self-care, enlisting support, all kind of together, because I think they're very, very much related. I think enlisting support is a coping skill. It's a way to manage stress. So in my mind, those things kind of all run together. So I kind of just put them on their own slide here. So some things that are noted to help. Taking breaks from news stories, including those on social media. It's good to be informed, of course, but constant information about negativity, negative events can be upsetting. So, you can manage stress by considering limiting your time on those things. I know especially when COVID was first here and it was very unknown and scary, a lot of clients that we worked with were very fearful. They were very, very anxious about COVID. I think the whole world was, obviously. But one strategy that we would recommend is kind of like be informed, but don't watch the news and all kind of the really scary stuff on the news all day long. You kind of have to learn to take some breaks from that just for your own mental health. And I think that's true for non-COVID things too. I think sometimes engaging in social media or watching certain things on the news or certain things can heighten your stress and kind of make you more anxious about things going on. So it's okay to take breaks if you need to and take care of yourself that way. Managing stress, like we talked about, all those other things, taking care of your body by eating in a healthy way, getting enough sleep, moving your body, limiting your alcohol, illegal drug use, or smoking can all help reduce your stress and can be a way to utilize self-care or a coping skill. Continuing with your regular health appointments, any tests, any screenings, any vaccinations that you and your doctor discuss that are right for you, kind of keeping up with all of those things and keeping your physical health up is a good way to keep yourself healthy, of course. taking time to unwind, and we could talk a whole day about this stuff also. Learning different strategies that will kind of bring your stress down, even just in the moment. I do this a lot with my clients. We talk about how when you're stressed, in your body, what happens? Your heart rate goes up, your breathing gets more rapid. There's a lot of physical things that happen. But what you can control out of all those things is your breathing. So if you can do some breathing exercises to slow down your breathing, that can kind of bring all those other systems down too. And deep breathing is great because you can do it anywhere. You don't need any special equipment. You can do it in the car, you can do it on the bus, you can do it in bed, you can do it anywhere. You've always got that tool at your disposal. So I think things like breathing, or even just like a meditation, just a mantra, even just repeating to yourself in your mind, those are things that I think are really great things to have in your toolkit because they can be done anywhere and often without anybody even knowing about it. But everyone, needs to find coping skills that work for them. Maybe going out and running 5 miles is great for this person, but there's no way that this person over here is going to do that. Or gardening, I like to get my hands dirty in the dirt, and that kind of calms me down. But other people, that might not be their thing. That might stress them out even more. So everybody can benefit from finding their own things that can help them cope with stress, get some self-care in, and I'd be happy to talk with anyone more about strategies for that, or if they need any help kind of identifying some coping skills for themselves. But you want to do things that you enjoy. You want to do things that bring you life, that fill your cup, and that remind you that, maybe the world isn't such a terrible place. There's some great things about it too. So practicing gratitude or journaling, there's all kinds of things out there that can kind of change our mindset to bring us some better mental health. And then connecting with others. So talking with people that you trust about how you're feeling, your stress levels, what's going on in your life, any concerns you have, connecting with any community-based organizations. I think it's great you all have this community as a support. It looks like if anybody's part of faith-based organizations, there's all kinds of places people can find supportive people. And they can be professionals, they can be a provider, they can be a therapist, or they can just be your neighbor across the street, or your granddaughter, or just anybody that you feel like is supportive and you can go to and that you trust. So I just wanted to share this again. And we talked about a lot of different strategies. And like I said, our mental health and our physical health, our heart health included, are related. Things that we could do to help one are likely going to help the other because they are so cyclical and our bodies are so connected. So any strategies that you can do it's going to have a big impact on both of these areas of your life. And I think that's it. Any questions? Yes.
Do you have any coping skills that might be specifically targeted towards like the seasonal and holiday depression, short-lived kind of thing?
Yeah, definitely. Yeah, I think any coping skill that is good for anything in general can be utilized in a specific circumstance too. I think, one that comes to mind is like journaling, for example. A person can journal and just kind of free write whatever they're feeling. There's also journal prompts, so you can even just Google journaling prompts and it might tell you like, journal about 3 things you're grateful for today, or journal about your favorite memory from childhood, or different things that can kind of prompt you to journal. And I would think that ones that are more related to certain areas of your life, like I've seen grief journal prompts or holiday journal prompts, so things that stressors that might come about in those different circumstances. I've seen a lot of journal prompts that can kind of get at those. I think specific support groups are great too. So support groups for people going through a certain diagnosis or experiencing a certain thing. So maybe like a winter doldrums support group, folks who kind of have a similar struggle with a certain area of their life, I think could be a targeted. Thank you very much. I appreciate that.
Thanks, MaryAnn.
Thank you guys. I really enjoy doing things like this. I hope you learned something valuable or useful, or maybe just had a nice snack. I don't know. But thank you guys for having me.